Hello, and welcome to the Advanced Care Planning webinar. My name is Jen Gabriel, and I'm the Director of Development and Community Relations for Hospicare and Palliative Care Services. Over the course of the next hour, we will be learning more about the important documents that help guide your family, healthcare workers, and other professionals in caring for you at the end of life. We'll also touch on how to have these conversations with your loved ones, as we know how sensitive and difficult they can be for so many of us. I'm delighted to be here with Dr. Lucia Yander, the Medical Director for Hospicare and Palliative Care Services, as well as a practicing physician in our community. Dr. Yander is passionate about this topic for many reasons and has knowledge and experience of the importance of end-of-life planning. Dr. Yander, thank you for being here. I want to start by asking you a simple question. Why is planning for the end of life so important?
Well, as they say, death and taxes, we have all been there, and this is something that we'll have to confront at some point. I feel that it is really important to think about these issues when you're not in a time of crisis. When you have to make decisions at a time of crisis, it is much more difficult to do so, and it is also difficult to make a good decision. So have been trying to educate my patients and, in general, members of the public about having these conversations well ahead of time when they are really, really needed. There are several good times when you want to have these conversations. Having your annual physical with primary care is a good time to do it. If you're facing a new diagnosis of a serious illness, that would be a really good time to have this conversation. Or if your situation has changed, if your caregiving needs are changing, if there is a major change in your family that would affect how people could care for you and could help you at the end of your life. Having this conversation ahead of the time enables you to put down your wishes the way you ideally would want them to be carried out. And it also enables your loved ones to know what the wishes are, to reflect on them, and to come together to a mutual decision that is known to everybody. And it is really important to put these discussions in writing. Because, as you know, if it's not written down, it may not stand. So I feel that it's always a good idea to have these discussions ahead of time, maybe multiple times, but do it when you're not in crisis, ideally.
And what would you say is the risk of not making and documenting these decisions?
Well, there are several risks. One is the risk to you. If your healthcare proxies, your family, if they do not know what you want, then they have to guess. And they may have to guess wrong. They may be asking for treatments that you would not have wanted, that may be too aggressive for the situation that you're in. Another risk is actually to your family, because we know that families are in distress when they have to make difficult decisions and they feel that there have never been a conversation about what would you have wanted as a patient. So it creates anxiety and stress for them. And the risk to you is that things may happen to you either too aggressive or too lenient as opposed to what you would have wanted to do. If you don't put these conversations down in writing, there is a process in the state of New York, and a process for healthcare proxy. If you're married, your healthcare proxy is your spouse. If your spouse is unable to function in that role, then it's your adult children. The next in line would be your parents, and the next in line would be your sibling, or perhaps even a friend. If there are people who do not have anybody, any family, then the state appoints you a healthcare proxy. And appointed healthcare proxies are knowledgeable people. They are usually members of the legal profession. The downside of an appointed healthcare proxy is that they don't really know what your wishes are, and they have to presume that you would have wanted everything, all aggressive care, even if it may not be in your best interest. What I also want to stress out to people that healthcare proxy and advanced care directive discussion is a discussion that should be held on multiple occasions. Anytime your situation significantly changes, it should be discussed it may turn out that your spouse would have been a perfectly fine healthcare proxy, but perhaps your spouse is getting older and is developing dementia. Or it may be that your child would have been a good healthcare proxy, but what if they are struggling with a mental illness or substance abuse problem? So it should be reevaluated periodically. In my practice, I try to do that at the times of annual physicals because that's kind of a hard stop. It reminds you that you should always look at these things.
So how do it's a great point to think about having this conversation with your doctor at your annual physical. How do you recommend that people get started outside of that?
It is really interesting that you ask. I mean, sometimes doctors are uncomfortable discussing this topic. And sometimes it really takes the patient's initiative to start a discussion. I think you should think about what would you want your end-of-life experience to be. You should think about your long-held wishes and values. What is important to you? I think these discussions should happen in an overarching setting of goals of care. What are your goals of care at the time when you're having this discussion? And the conversation may be very different for somebody who's in their late 80s and has a lot of chronic conditions, as opposed to somebody who's much younger and may have an acute medical situation that, even though may be very difficult, but there's a good chance that it would stabilize. So think about your life, think about your resources, your support system, your health condition, and about your opinion, how do you feel about end-of-life care? And that should guide your decision making.
So if there was one thing that you wanted people to take away from this session today, what would that be?
I think the most important discussion is pick a healthcare proxy that you can trust and you have comfort with, and you know that you can discuss what you really wish to do. Your healthcare proxy should be somebody who functions well under stress. They only come into play when you cannot speak for yourself. As long as you can speak for yourself, then everybody follows what your wishes are. So I have had families when the spouses said, I don't want my wife to become my healthcare proxy. This would really be too much of a burden, and she would not be able to function in that role if she saw me really, really ill. So think about a healthcare proxy as somebody that you trust, that functions well under stressful situation, and that he or she will carry out your wishes the way they are. I also think it is important to have an alternate in case your primary healthcare proxy cannot function in that role. And when you pick in an alternate, make sure that the primary and the alternate can work well together. They have similar opinions about your care, and they both work well together on your behalf.
So in addition to the healthcare proxy, are there other documents that you would recommend that people prioritize?
I think especially as people get older, or if they're diagnosed with a serious illness that may be terminal in next 2-3 years, I think it is really important to have a discussion with your doctor about medical orders for life-sustaining care. And if you have seen them, it's the pink form. And that discussion talks about resuscitation, talks about how aggressive do you want your care to be? Do you want any limitations of your care? Do you want a feeding tube? Do you want intravenous fluids, antibiotics, dialysis? Do you want to be sent back to the hospital? That discussion ideally, again, is done in the overarching theme of goals of care. What are your goals of care? And have the discussion with your doctor. I think it is really important while having the discussion that you understand what is your medical situation, and you have hopefully a realistic assessment of what your options are and what the burdens of different treatments would be. And not just medically speaking, medical burdens, but the burdens on your family, the burdens of how much time would you have to spend in the hospital, what are the likely side effects, how this is going to impact your life.
So once I have all these documents in place and I've had the conversation with my healthcare proxy, what do I do with the documents and the information that I've collected?
So, many times these discussions take several visits because when you introduce the topic, sometimes people are, oh, I didn't know I have to think about this. But it's actually really helpful to think about this when it's not a crisis situation. So after you have had a chance to think about these issues, talk to your family, talk with your doctor, and put them down on paper, then you should have a copy of the medical orders for the life-sustaining form as a patient. You should ask for a copy to be left with your doctor. You can send a copy to the hospital. You can have a copy with a family lawyer if you have one.
Great. And, to talk about the sort of tough part of this, often for a lot of people, is how to start the conversation with their family, whether that's their spouse or whether that's the extended family. How do you counsel your patients on beginning that conversation? What are some things to think about?
I think that the important piece is you want to tell your family members, I'm doing this because I'm trying to do you a favor. I'm trying to have this conversation when we have time and we have expertise in our hands and we can really discuss these things. Ideally, don't wait when there is a crisis because it's much more difficult to make decisions in a time crunch and in the times of emotional turmoil. So I would start the conversation as, I understand I'm getting older. I think this is really important to me. And I want to ease the burden on you in case you have to help me making decisions. Sometimes I tell my patients at the time of the physical, it says, it's me who's initiating this conversation. This is really important for you. And if you want to go home and talk to your spouse, then you blame me. It was my primary care who told me that I have to have this conversation. And that may be sort of an indirect way to do it, but it works pretty well.
That's great advice. Well, thank you, Dr. Yander. This has been really helpful, and I want to thank you again for joining us. And I also want to remind everybody that Hospicare is here to support residents of Cortland and Tompkins County, and you can always reach out to us for information or to ask a question. Our website is www.hospicare.org, and the phone number is 607-272-0212.